Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Malnutrition. Introduction. Food provides the energy and nutrients you need to be healthy. If you do not get enough nutrients, you may suffer from malnutrition. A person with malnutrition may have no symptoms, but sometimes malnutrition can be so severe that it causes permanent harm to a person's body. This program explains malnutrition. It discusses the symptoms and causes of the condition, as well as treatment options and prevention methods. Malnutrition. The body continuously uses energy to keep the body healthy. Energy is measured in calories. A calorie is a unit of energy that is made available to the body by the food we eat. The number of calories needed to keep the body healthy depends on a person's age and size. A growing child needs more calories for each pound of body weight than an adult. This is because a child is growing. Calories are needed to fuel growth. In addition to taking in the right amount of calories to give your body energy, it is important that a person takes in enough nutrients. Malnutrition happens when your body does not have the right balance of nutrients. People suffer from hunger because they do not get enough food. Not getting enough food over the long term can lead to malnutrition, but someone can become malnourished for reasons that have nothing to do with hunger. People who have plenty to eat may still be malnourished if they do not eat food that provides the right nutrients, vitamins, and minerals. Nutrients that your body needs to stay healthy include carbohydrates, fats, minerals, proteins, vitamins. If you do not get enough of one specific nutrient, it is called a nutritional deficiency. A nutritional deficiency is a form of malnutrition. The most common form of nutritional deficiency in the world is iron deficiency, which can lead to anemia. Symptoms. A person with malnutrition may have no symptoms, but sometimes malnutrition can be so severe that it causes permanent harm to a person's body. Symptoms of malnutrition can include dizziness or fainting, dry or scaly skin, fatigue, hair loss, poor wound healing, weight loss. Malnutrition can also lead to a weak immune system. This increases a person's risk of developing infections. If malnutrition goes untreated, it can lead to illness, swollen, bleeding gums and tooth decay, slowed reaction time or trouble focusing, weak muscles and bones, organ failure, death. In women, a sign of malnutrition may be skipped or missed periods. Sometimes malnutrition may cause periods to stop completely. When a pregnant woman is malnourished, her child may weigh less than normal at birth and have a smaller chance of survival. Lack of growth in children can be a sign of malnutrition. Malnutrition affects people of every age, although babies, children, and adolescents may suffer the most. Many nutrients are vital for normal growth and development.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Causes. One of the main causes of malnutrition is a lack of specific nutrients in your diet. Even the lack of one vitamin can lead to malnutrition. Other causes of malnutrition include having certain medical conditions, taking certain medicines, problems with digestion or nutrient absorption. Some people become malnourished because they have a disease or condition that prevents them from digesting or absorbing their food properly. Certain medical conditions and medicines can cause decreased appetite, decreased digestion and nutrient absorption. Too much alcohol can interfere with the digestion and absorption of various nutrients. People who abuse drugs or alcohol might be malnourished or underweight. People with anorexia, bulimia, or other eating disorder are also not eating properly and are at risk of malnutrition. Epidemics of malnutrition and starvation can be caused by natural disasters, political problems, poverty, war. The elderly also are at higher risk for malnutrition. Older adults often have health issues that can lead to decreased appetite or trouble eating, such as chronic illness, difficulty swallowing or absorbing nutrients, trouble chewing due to dental issues, use of certain medicines. A recent hospitalization might be accompanied by loss of appetite or other nutrition problems. In other cases, a diminished sense of taste or smell decreases appetite. Diagnosis. To diagnose malnutrition, your healthcare provider will perform a physical exam. He or she will ask you questions about your personal and family medical history as well as your diet. When checking for malnutrition, a healthcare provider may check a person's height and weight or body mass index to see whether it is in the healthy range. Check for diseases or conditions that might be the underlying cause of malnutrition. Use blood tests to check for nutritional deficiencies. Other tests may also be ordered based on medical history and the physical exam. Healthcare providers may perform tests to diagnose malnutrition based upon the specific disorder causing the condition. Treatment. Treatment for malnutrition focuses on replacing missing nutrients, treating the underlying cause of malnutrition, treating related symptoms. To correct problems related to malnutrition, your healthcare provider or dietitian will recommend specific changes in the types and amount of foods you should eat. Your healthcare provider may prescribe dietary supplements such as vitamins and minerals. These can help replace nutrients missing in your diet. To treat severe malnutrition, a person should be given food in gradually increasing amounts, by mouth if possible. But sometimes nutritional supplements are given through a tube passed down the throat to the stomach or inserted into a vein. Most nutritional deficiencies can be treated, but if malnutrition is caused by a medical problem, the illness must be treated. Prevention. The best way to prevent malnutrition is to eat a healthy, well-balanced diet. Eat a variety of foods. No one category of food can give you all the nutrients that you need. A healthy diet always includes food from different food groups. Food groups include fat and cholesterol, carbohydrates, protein, vitamins, minerals, fiber. Cholesterol is found in animal products such as meat, eggs, and dairy products. Some examples of carbohydrates include beets, breads and cereals, pasta, potatoes, rice, sugar. Protein can be found in dry beans, eggs, fish, meats, nuts, poultry. Examples of vitamins and minerals include calcium. Dairy products are rich in calcium. Iron, salt. Vitamins and minerals are found in plant and animal food sources. If you are on a special diet, you need to be careful about eating balanced meals and a variety of foods to get the right nutrients. Vegetarians and vegans, for example, need to make sure they get enough protein and vitamins like B12. Talk to a healthcare provider or dietitian for help on planning healthy meals that include a variety of nutrients.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Food provides the energy and nutrients you need to be healthy. If you do not get enough nutrients, you may suffer from malnutrition. A person with malnutrition may have no symptoms, but sometimes malnutrition can be so severe that it causes permanent harm to a person's body. Symptoms of malnutrition can include dizziness or fainting, dry or scaly skin, fatigue, hair loss, poor wound healing, weight loss. If malnutrition goes untreated, it can lead to illness, swollen, bleeding gums and tooth decay, slowed reaction time or trouble focusing, weak muscles and bones, organ failure, death. One of the main causes of malnutrition is a lack of specific nutrients in your diet. Even the lack of one vitamin can lead to malnutrition. Other causes of malnutrition include having certain medical conditions, taking certain medicines, problems with digestion or nutrient absorption. To correct problems related to malnutrition, your healthcare provider or dietitian will recommend specific changes in the types and amounts of foods that you eat. Your healthcare provider may prescribe dietary supplements. The best way to prevent malnutrition is to eat a healthy, well-balanced diet.
Thank you for using Explain.